I would like to add to the conversation Dr. Mark Feldman. Now, Dr. Feldman is an adjunct professor of psychology at the University of Alabama, and he is an international expert on factitious disorder and the related conditions. He's also written 5 books on the so-called medical deception. Dr. Feldman, it's good to talk to you again.
Good to talk to you too. Thank you.
Let me start with this. Is this really a mental illness, or is this just really bad behavior?
Well, the American Psychiatric Association sort of straddles the fence. They say that it is a mental illness, but at the same time, they don't refer to these people as being patients. They refer to them as being perpetrators. Munchausen by proxy is a term that I tend to favor along with medical child abuse, because those are behaviors, and it makes it clear that regardless of how you view it as a form of mental illness or not, it is a potent form of abuse with a high mortality rate.
What makes a person like this do this kind of thing? What's their motivation? Are there common elements to these people? Because I'm looking at, there's an awful lot of mothers in this audience right now, and they're looking just in shock, like who the hell could do this to a child?
Yeah, it's stunning. I've been studying this for 30 years, and I still find it amazing that mothers whom we think of as being so nurturing and so caring can be transmogrified into evil people. It seems that most, if not all of them, have severe personality disorders, especially borderline personality and histrionic personality. And that simply means that they have long-term self-defeating ways of trying to get their needs met. Instead of asking for help, they engage in abusive behaviors. And being the parent of a terribly ill child gives them a very clear role in our society, and it also gives them the admiration of high status professionals like doctors, nurses, and others. The whole community may rally around them. It's hard to imagine that a mother who comes across as being the ideal parent could in fact be an abuser. And so you see situations like Annie and Josh have gone through where there have been multiple red flags and warning signs over the years, and yet nobody seems to have done anything much about it. Doctors just prescribed more medicine and took the mother's reports at face value. And we see what the children have gone through as a result of that.
Yeah, and one of the reasons, of course, is they doctor hop. And then there's no way for former doctors to tell new doctors that they think this person was not a reliable historian.
So these cases slip through the cracks all the time.
Yeah. Now, Annie was just talking about the fact that she did reconnect with her mother, and you were saying one of the common elements to these people are personality disorders, often borderline personality or histrionic personality. And let's talk with Annie about what that means.
Personality disorders like borderline personality are long-lasting, chronic conditions for which we don't have consistently effective treatment. So instead, the person continues to act out. They typically don't want treatment, even if it's made available to them. And so the same behavioral patterns recur and recur and recur. And I think you, unfortunately, have been a victim of that and have seen that firsthand.